that have to do with the professional beauty industry. And through that, we do a lot of education on the products that we carry, as well as education on how to care for the primarily the feet, but the hands as well in the professional arena, so that we can take care of our end user clients.
Okay, Brooke.
Hi, my name is Brooke Devlin. I own Brooke Christina Skincare in San Jose, California. I have been an esthetician for about 5 or 6 years, and I really specialize in ingredients, cosmetic ingredients, and oncology aesthetics. I took a wonderful course from Becky years ago, and yeah, that's pretty much it.
Okay, Julie.
My name is Julie Bach. I'm the Executive Director for Wellness for Cancer. We're in 54 countries, and we do very similar to Becky. You know, we train on skin and manicures, massage, and yoga for people with cancer.
Perfect. Naz. Are you on mute? You are muted.
Unmute him.
Mute. Can you guys hear me?
Yes.
Yeah.
Good morning.
My name is Naz. Like, tell you the quick story. I was a waiter and I used to get pedicure, and I hate the smell of the nail salon, and I used to get very, very sick. And I was looking for a place to get manicures, but no chemicals in there. So I couldn't find any. So finally decided to open in 2007. It's still up to today. We are the only certified organic salon in the country. We don't do any artificial nails. We don't do no gel, no acrylic, nothing. So people walks in there, if they have artificial, then we don't even work on them. You have to go somewhere else, take it off and come back. So we build a place. So we cater to a lot of people with asthma, allergy, cancer patient, people with pregnant women, little princess.
Aww.
And then a few years back, like maybe 4 or 5 years ago, we started making our own products. I own a patent on all my removers. Now it sells everywhere. Here I am 14 years later, you know. Thank you so much for putting together this amazing event.
Great.
Thank you for being here.
So happy to have everybody on, and welcome. So we'll get started. What do you think, Becky?
Yes, and let me give you remote control. You know,
Okay.
then you can move your part of the slide. So I'm giving it to you right now.
Okay, perfect. Oh, whoops.
I never done this before, so if I do anything.
Okay, excellent. So let's get started. So I'm Shamli Singhal. I'm a surgical oncologist, and I practice here in Silicon Valley. And we started Hope and Beauty in 2019, and really to talk to people and to patients about oncology related things that the doctor doesn't really discuss, but really bother patients. So I'm going to tell you a little story to start about a patient of mine, Brigitte. And Brigitte, by training, is a stylist. I mean, that's what Brigitte does. And she got cancer about 5 years ago. And she had all the treatment stuff done, and she went lots of different places looking for the solutions for the things that were troubling her. And so she said, when I began my fight with cancer, I had no idea about all the things that would take place, that would happen to me. And for her, you know, she wants to be pretty. She wants to get up in the morning and look in the mirror and feel pretty and feel good about herself. And the cancer and the chemotherapy really changed the way she was. And so when she looked in the mirror, she had flaky, dry skin discoloration, toenails, nail thinning, hair thinning, among all the other things. So when she talked about it, about where she went to look for solutions. And she said, oh, you know what? There really weren't any solutions. I went to the salon. Nobody wanted to touch me because I had cancer. I went to the beauty counter. Nobody knew anything about it. I went to the nail place and they didn't want to touch me either. And she didn't have any solutions for the stuff that she looked at every day. And you know, for her, it wasn't a vanity item. It was really that she wanted to feel good about herself, and she wanted to continue the life that she was participating in, despite the fact that she had chemo. Not as, you know, not as a thing that really was, well, I know I'm going through chemo, but I really have to have my nails done. It wasn't like that. It was really that having my nails done, having my hair done is really part of who I am. It's about how I take care of myself, how I move forward. And so, you know, they have all these books that they give to cancer patients, and people say these things to cancer patients all the time: stay strong, be positive, look on the bright side, or whatever people say to you. But you don't necessarily know how to get there, right? How do you stay positive? How do you then take all these little things that add up to who you are and continue forward? All right. So if you talk to patients, right, they say, you know, I just want to feel normal. But what does normal look like? What normal looks like is that you can wake up in the morning, look in the mirror, and feel like that person in the mirror is the person you were before you started treatment, right? Which you may or may not be. There might be some differences, but there are lots and lots of things that we can do, which patients don't really recognize, that will help you get to that sensation. And once you feel that sensation, then you can turn the world a little bit more positive, right? And what we'll talk about a little bit later is that there's a whole bunch of stuff that patients don't tell their doctors, right? I see patients for surgery, and what happens is that you have 15 minutes to talk about these really complicated things. And then the patient goes home, looks in the mirror, sees that they don't have any hair, looks at their cracked nails and says, oh my God, that's not me. And they don't talk to the doctor about it. So the impact of the disease isn't really as evident. Okay, so our agenda today is I just finished our welcome to our Hope and Beauty workshops, and I'm going to talk a little bit about the problems that people have with their nails, and then we'll go to Brooke, who will talk about the ingredients. We'll talk to Naz and see what his experiences have been. Becky's going to talk about how to do a manicure. Julie's going to spend a little time helping us to focus and treat the time that we spend with our hands as a mindful moment. And then we'll have a little bit of Q&A, because what you may or may not appreciate is all the people in this room have years of experience. And so this group of people have fabulous tips for everyone. And so we'll go to that towards the end. Okay. So chemotherapy and nails. Now, it's one of the kind of hidden topics. So the first day cancer patients get a teaching, like these are the things that are going to happen to you. And buried down in the bottom of one of those little pieces of paper, it says, oh, and it might affect your skin, hair, and nails. And that's all anybody ever says about it. And no one ever really sits and explains to you why this stuff happens, because the trouble with the cancer is that it can, we have to treat the whole body. So when you treat the whole body, you give medicine that treats the whole body. And one of your organs, which you don't necessarily appreciate as much, is your skin. So your skin is a big organ in your body, and the chemotherapy goes into that. And it affects the rapidly dividing cells, as traditional chemotherapy does, mostly the rapidly dividing cells. And skin, hair, and nails, and your GI tract are really the rapidly dividing cells. Those are the things that get affected first by chemotherapy. Those are the ones that have some lasting changes with them. Some examples of the medications that you might take are Taxol, cisplatin, 5-fluorouracil. Those are common agents that people get, and they really affect the skin and hair and nails. So we talk about what to do once you start treatment, and the treatment, the chemotherapy will get into your skin and all your hair and nails and all of these things. And what do you do during the period of treatment? And what we recommend, and what we really try to discuss, is that that's a time where you're protecting your skin, you're calming and you're hydrating, and you're allowing the skin to heal itself. These are words from Becky, and these are Becky's direction that says, we want you to use products that are clean, that have quality ingredients in them. We want to understand that your hair, your skin, your nails, all of that may be a little bit more sensitive than you used to have before. And that all of your old products may just not work for you, because remember, you're having a medicine that changes the quality of your skin and your hair and your nails. So what it is currently may not be what you had before. And has to do with the medication that's in there. It has to do with a whole lot of things that you don't have a lot of control over, but you should at least recognize that there is a change. And for all the products that you use, we want you to patch test them. And we can give you directions on patch testing them, but really you put them in a place where if it flares up, it's not on the tip of your nose where everybody's going to see it. And the products in this presentation are suggestions. We all have different recommendations for what might work for you, different ingredients, different thoughts about it, and they may not work for everyone, but they're a good place to start. I have a really good friend of mine who's in love with products, and she loves trying products. And if you look in her bathroom, she has 500 products of all the different things that she tried. So we're giving you a starting place to look at these products, and hopefully that's ones that work for you. So when we talk about damaged skin, the skin has a lot of functions which you don't necessarily appreciate when you see them, right? Normal skin has a barrier function. It has an immunologic function. It has a water loss function. It has a protection function from the structures underneath. And so all of those things for right or for wrong, if you have damaged skin, can be changed. So on the picture on the left-hand side is just an infographic really about what normal skin is supposed to look like, right? And it looks essentially like a brick wall, and there are layers to it, and there's a protection on the top. If you imagine the brick wall got cracked, then you have a crack. Depending on how deep the crack is, you can lose water. Things can come out of the skin that should be in the skin, and things can go into the skin that shouldn't be in the skin. So that being a really semi-simplistic way of talking about it, but the key item here is not to get cracks in your skin. And so how does one go about doing that? We'll certainly talk about. Now, there's a lot of discussion about, and every cancer patient on one of those line items in their chemo teach says, don't get a manicure while you're having chemo, okay? But no one ever really explains why that is, right? Why can't you have a manicure? I mean, many people have a manicure every 2 weeks. It's part of their routine. It's part of how they take care of themselves. It's, if you have a cracked nail or your nail's growing out, you're like, oh, this is terrible. I have to get it fixed, right? I can't live like this with all this stuff on my nails. And the explanation of why you cannot have a manicure has to do with the breaks in your skin. It has to do with the sensitivity of your skin to damage. So when they give you these instructions that say caring for your nails, really what you want is clip your nails short so you don't get tears and breaks in your nails. Wear gloves when you're doing chores. And so if it were me, I would just say, oh, sorry, I can't do the chores. But if you have to do the chores, then you're going to, when you're washing dishes, it's going to be kind of a rubber glove. Or if you decide, those little white, there's some white gloves that you can buy. And if you're doing things in the garden, around the house, just remember to protect your hands. I guess this is what the message of the wearing gloves part is. Use nail polishes that are free of chemicals, such as formaldehyde, parabens, toluene. Use nail polish remover that's free of chemicals, and no gels, no acrylics. And be very careful of the cuticle, right? The cuticle is a vital part of your nail and your nail health. And so you don't want to damage those cuticles. We talk about massaging the cuticles with oil, with moisturizer, with cuticle oil, all of those things. And if you really decide that a manicure is something that you really need to have, then there are a couple items. Remind them not to push or cut your cuticles with those tools, and bring your own tools to each and every manicure, right? And then in one of our blogs and stuff, we'll talk a little bit about how to clean your tools so that they're carefully cleaned. So this is a picture of my hand, because I was looking for a picture of semi-normal nails. And so I took a picture of my hand, and I just want to tell you a little bit about and unfortunately it's a little bit small, but really the portion that if you can see the arrow, the part of the nail that is important to understand is something on the edge, which is the perinechiae. And then this is where the nail grows out of. And it grows out of the bottom of the nail where the cuticle is. And a lot of the rapidly dividing cells are here. Okay. And so when the nail grows, the cells divide at the base of the nail, and they're nourished by the skin around the nails. And that nail around the nail is where the barrier function is. And so where you see the cuticles and where they push back your cuticles, it's really a barrier function. And so it puts a seal so things don't get under the nail if they don't have to. And they also don't, when you see that the nail bed is actually thin, when you look at your nail, and if you want, I can show you my nail, but you can see the blood flow under the nail. You can see a nice healthy pink nail. You can see a strong nail because the nail growth is from the underside, and it adds layers as the nail grows to the underside to give you a thick nail. All right. And the cuticles themselves, sometimes they hang off, sometimes they get sore, sometimes they get infections under the nail, but it's all because the moisture can't penetrate under the nail because of the barrier function of the cuticle and the perinechiae and the way that the nail sits on the finger. Okay. So, and why is that important? Because if you look at what a generally healthy nail looks like, and then you look at what happens to people when they have chemotherapy, and what you probably don't appreciate is how many people have this problem. So 40% of patients they're on a Taxol-based regimen will develop problems with their nails. So they'll get nail bed hyperpigmentation. Which means that the nails turns black. I mean, I'll show you a picture of it a little bit later, and you'll see it's just wrong. Like, you just look at it and you think, why? What's happened to me? You also get this sensation that the nails are no longer sitting on the bed, and that's called oncolysis, where the nail bed lifts off and the nail becomes very brittle and it starts to peel off. And then you also get these sensations in your fingers where you no longer can feel the tips of your fingers, and you get all these pins and needles. So all those things put together make it very hard to do simple things. You can't button your clothes, you can't comb your hair, you have to wear clothes with zippers. And when we talk a lot about disease, right? We as physicians, we treat disease, right? We give you medicine, we take surgery, we do all these things. What we're not so great at is really understanding what is the impact of that disease on you. And so that's the illness, really. That's where, can you imagine every day you can't button your clothes? Can you imagine what the impact is on your life? You can't hold a cup of hot coffee. You can't hold a fork or a knife or something like that. That's the impact of these little things. And so if you then can fix some of these little things, then we will have done really a good service to people, because then we will have fixed it, right? And what a lot of cancer centers are going to, and I show you this picture because you can see how unwieldy this is. They want you to, when you're getting your chemotherapy, if you cool the nails, right, then the chemotherapy doesn't get all the way penetrating into the nails and the nail beds and all that stuff. And you end up not having as many nail complications. Okay, but look at these mittens. These are the mittens that you have to wear for 7 hours while you're sitting in the chair. So you get your chemotherapy all day long. It goes 6, 7, 8 hours, right? So during that time, every 45 minutes, you have to refill these gloves with ice packs. And you have to sit there with ice packs on your hands on these mittens to do this prevention. It seems like a lot. It seems, that this solution, it's a solution, but I'm not sure it's a solution that anybody can viably do, but people try and do their best. So this is a patient of mine, and talking really about this pigmentation, right? And so if you look at her nails, what you see is a sort of blackish tenor to it, right? And the nails don't grow as much. Normal nails will grow 2 to 3 millimeters a month. It's not very fast. But so what you've ended up doing is this woman had this very blackish tinge to her nails. Okay. And this would have to probably zoom in a little bit closer, but this is this oncolysis. This is, if you look at this lady's left hand third finger, which is where the arrow is, what you can see is it's black. And then you can see the nail kind of lifting off on the tips of it. And so it gets cracked. And what happens is that the patients then where the nail gets cracked and it's starting to lift off, they get infections under there. and the infections then lift off the nail even further, and they're very painful. And so sometimes people have to get dose reductions of their chemotherapy because the nails get infected and you can't have chemotherapy with an infection. And then eventually the nails kind of lift off enough that they crack and fall off. So then you're left with only half a nail to protect your finger. So this is just giving you an idea. And now this picture is a little bit hard to see, but I only these are kind of organic pictures in that I took them in the clinic. But this lady had breast cancer, and she finished her breast cancer treatment 6 months before this picture was taken. Okay, so when you look down at her toes, you see this kind of blackness everywhere. You see this lifting off. You see the quality of her feet. They're kind of dry, and the toes don't look like they're having a good day. And so she went to the podiatrist, and the podiatrist took off half of her nail. Where the arrow shows is that the podiatrist actually removed half of her nail. So we, a number of years ago, looked at what is it that we can do on the medical side, because there's a lot of medical literature on what ingredients, what stuff actually helps you to prevent some of these complications other than the frozen gloves and socks. What can you do to improve the quality of these nails? And there's a trial that was published in ASCO about this compound called Polybalm, and Polybalm is a lot of essential oils and some very, there's 4 essential oils, and there's a lot of emollient type stuff in this Polybalm. But they did a double-blind, randomized trial looking at the efficacy with regard to nail complications from Taxol. And they found that, and they had randomized groups, and they found that it substantially improved the quality of the nail. Okay, so this patient that I was telling you about that had these foot problems, I gave her the Polybalm to try it out and see how she did. So on the upper left are the pre-treatment nails. And then as you can see, over 6 months, her nails grew out a little bit in the pre-treatment thing, but they still retained their black, right? They were very black, right? And as you see, in 1 week, there was a little bit of clear nail showing down at the bottom. Then at 4 weeks, there's a little bit more. And then at 12 weeks, her I don't know what you call this, the third toe is actually completely clear. And so this, I'll put the arrow there, but this toe is actually completely clear. This one is substantially thicker, and then the area that is clear nail is better, and the black is starting to grow out. But if you look at her foot also, that there's a lot more moisture in her foot, and there's not as much cracking around the edges. And so she doesn't feel as much pain that is associated with that. And the pain that was associating when she was in this state was meaning she couldn't walk. She couldn't put shoes on. She couldn't put socks on. And so all of those things improved. I mean, granted, it took 12 weeks, but compared to where she started, I feel like we got some improvement. And this is her other toe. This is the toe that the podiatrist took the nail off of. And again, you can see this kind of blackness is lifting. There's a little bit more nail there. And in this one, there's a little bit more nail, and the nails seem to grow a little bit better. So I'm going to switch a little bit now to another class of drugs that a lot of breast cancer patients get, Herceptin. So this is another one of my patients who had the lifting off of her nails. I showed her picture before, and then she started getting Herceptin. And so these were her nails. And you can see this whole front portion of the nail just lifts right off. And it's, again, they get brittle, they get infections, they get all different things that get under there. And this I took from the internet so that you could understand. So if you look, this is the nail itself, and this is the nail bed and the cuticle. But if their barrier function is broken through here, you can get actual infections that have to be drained and abscesses that lift off the nails and lift up. So why do I say this? Is because these are things that are important to people, right? How your nails look, and they're important to function because you have to use your hands every day. You have to be able to button your clothes and all of these things. So if your hands feel good, then you can do all of these things that you need to do. And it's not a constant reminder that you're under treatment. So we at Hope and Beauty put together a box, and they're filled with Naz's products to help you with these various things. And so I'm gonna turn the microphone over to Brooke, because I think we can talk a little bit more in the end about after Becky and Naz speak about this, and you can see why we chose what we chose. Okay, Brooke?
You're muted.
Sorry about that. Could we switch over the, are you going to control the?
I will send it to you if you would like to. So let's give it to you, Miss Brooke.
All right. Hey, everyone. So I am, again, my name is Brooke Devlin, owner of Brooke Christina Skincare. And today I'm going to talk about nail product ingredients and the main ones to avoid. There's a lot, but, and I'm going to write a blog actually about what I go over in this presentation. So afterwards, if you go to my website, brookechristinaskin.com, this information will all be there, because it's, you know, a little hard to take in all of these really specific things. But if you want to take notes while I go through, that's a good way too. So I'm going to talk about the big three to look for in your nail products and ones to try and avoid. The first one we'll go over is formaldehyde. I know a lot of people are familiar with this one. The second one is toluene, and the third one is dibutyl phthalate, DBP. Okay. So formaldehyde, you know, there's a lot of different organizations that study these ingredients, not just in the US, actually particularly overseas in like Europe, Canada, and according to the FDA, formaldehyde acts as a nail hardener. So, you know, usually it's part of the nail polish that you're going to see. And in Europe, on the Committee on Consumer Safety, they identified that formaldehyde can be used in concentrations of 2.2% or lower. So what does that mean? You know, in regular terms, is that if you see formaldehyde, first of all, try and avoid it in your nail products. But if you absolutely can't, it should be like the last ingredient on your on the actual product list of ingredients. So any of these that I go over, there's going to be studies saying that you shouldn't use these at all, which I personally agree with. But if you absolutely can't avoid it, make sure it's the last ingredient, because the first 5 ingredients are the ones that are going to be the majority of the percentage of cosmetic ingredients in the formula. But and also it depends on how many ingredients are in the formula. So for example, if there are 20 ingredients in a nail polish or a nail product, that's going to mean that the last 1 or 2 have a smaller concentration than if there's only like 6 ingredients. So just keep that in mind for really any cosmetic product. So it is a known carcinogen, according to the International Agency for Research on Cancer. An alternative to helping the nails harden would be biotin. So that's something that, you know, obviously checking with your doctor it helps reduce brittleness and nail splitting. If you can't do that during treatment, maybe your doctor can, you know, tell you that you can use it after treatment so that it helps the nail regrow. And formaldehyde is also known among other names. So a lot of times in product, you'll see that even though there's like parabens or formaldehyde, it's going to be under a different name, which I will list on my blog. Okay, so let's see. All right, toluene. So it's safe for use in cosmetic concentrations less than 50%. It is a known carcinogen and may affect female reproductive systems. So I would just avoid it in general. If you look for products labeled as 5 free, that means like the 5 most, I'm talking about the big 3, but there's also like the big 5. Which I just wanted to go over a few of the main ones so that we can, not get too overwhelmed. And at the very end of my presentation, I'll have a list of ones that you should avoid. They're all like these, really long names and whatever. So I didn't want to go over too many, but usually the 5 free will not contain formaldehyde, toluene, DBP, which is that dibutyl phthalate, xylene, and TSFR, which is a chemical reaction between formaldehyde and toluene. Okay, dibutyl phthalate. It's a plasticizer in nail polish, so that's going to make it a little bit more shiny. The EU has classified DBP as a suspected endocrine disruptor and reproductive toxin, which, basically I would relate that more to ovarian cancer, breast cancer, those types of cancers caused by the endocrine system. And camphor is used sometimes as a replacement, but that even should be used in concentrations less than 3%. Camphor comes from the camphor tree. So this is to say, even if something seems natural and it seems it's, derived naturally, you also want to check just to make sure that, maybe it shouldn't be used in a higher concentration, but there's also side effects from natural ingredients in general. And the last thing I'm going to go over is colors. So mainly look out actually for red and violet. These are produced from coal tar, which are known carcinogens and also tested on animals. So FD&C and D&C ingredients, or a color with a number after, like red 34, violet 2, those should be avoided the most. And then the last slide is those 10 other ingredients to avoid. We can, glitters with made with microplastics, xylene, benzene. So anything with oxybenzone or benzophenones. No, it's butyl alcohol. So there's a lot of different ones, but I just wanted to go over the main 3 plus the colors, and that's pretty much it. Should I interview Naz now?
Yeah, that's good. It's a good time because then Becky will demonstrate a manicure. So it's a good time.
Great. So Naz, I just wanted to ask you a little bit about Karma Organics, your company. And let's start with, I know you talked a little bit about the story and what inspired you to create Karma Organics in the beginning of the workshop, but is there anything that you wanted to add to that about what inspired you not just to open up a spa, but to create your own product line?
You cover most of it anyway, but so all my products. So when I was opening the salons, and I was gonna do no colors and not using any, just buff the polishes. But as a New Jersey salon owner in 2007, everybody wants to walk in and they want either acrylic, gel, or they want a color. Without that, it's not gonna work. So I tried it for a little while, but didn't work. So then I said, you know what, I gotta come up with a product. So I get down to the drawing board and come up with the products. I actually own the patent on my remover. So doesn't have any chemicals, and same thing with the polishes, and all the polishes are made in USA. So all the ingredients you listed doesn't have none of those items in there.
Okay.
Even the bottles for the remover made in USA, even the caps are made in USA. I don't know if you know about it. Locally sourced. I don't know.
Great.
And when doctor told me about all these lifting things with the cancer patient, we seen it all. And we were doing PPP before even this happened. So we are the first salon to use, instead of using those tops, like you go to the pedicure chair, we never had it from the beginning. We have actually a bowl. We carry a bowl to you. We put a liner. We've been doing since 2007, the liners. We were using the liners. Before that, we used actually a garbage bag before, because we didn't have the liner. Nobody makes the liners. Now people making liners. So we always wear the Nitro Gloves. So because people with allergic to powder or, all the chemicals like latex chem. So we were using the Nitro Gloves since the beginning, where nobody knows about. People used to get like, why are you wearing gloves? You have a problem. People actually question us that why you guys wearing a glove doing our pedicure, because some people say, oh, it doesn't feel good when we do massage. And we have to explain to them it's to protect you and protect us. If you have something, we don't, and we were using disposable items. The files, we've been still up to today. We've been use one file, and we break the file after your pedicure and manicure. So if you have manicure, pedicure, we use 2 files, 2 buffers, 2 cuticle pushers, orange sticks, and we break it in front of you. So if you don't break it, you don't have to pay for mani-pedi. So we actually break in front of it to make sure that it's never been used. And people actually know, some people notice, some people don't care, but but people do care that, oh my God, this is amazing that you guys actually doing this. Now people noticing more. Like before, people say, whatever. But now they say, oh my God, this is crazy. You guys been doing it since 2007. We never noticed that, So.
Yeah, I am a huge fan since I was introduced to your line. And I really enjoy that, the nail polish remover. It's so unique. I've never tried a nail polish remover that actually feels like it's hydrating my nails and my cuticles. But I know it's made from soy. Is that correct?
But by the time, we actually have a very, very small amount of soya in there.
Oh, okay.
It's non-GMO. And also once we cook it to 400 degree, and it's actually take all the effectiveness of the soya. So it's basically, we have to use the soya, but it doesn't affect, like if somebody is allergic to soya, it's not going to affect them at all. By the time it cooks and put together.
What is the main ingredient in there?
I can actually bring you the bottle because I can't pronounce it, be honest with you.
It's a lot of the names are kind of crazy.
Big question, Brooke, because I wanted to ask him the same thing. I tried it for the first time this week, and I was amazed at how it took the nail polish off without any acetone.
I know, it's amazing.
I especially like it because it's unscented. He has one that's unscented.
Oh, you have it in your hand, yeah?
Yeah, I have it. It's propylene carbonate.
Okay.
I can say it.
I'm Pakistani. I can't pronounce all of these things.
Yeah, so it's propylene carbonate, soybean oil, methyl ester, and tocopherol acetate, which is vitamin E.
And if you can send me, put a list of everybody's address, I love to send it to everybody. I think it's 18 people on the list right now, right?
Yeah.
I send the polish and I put a little care package for everybody.
Yeah, nice. Thank you.
Wow.
Yeah. So, what has been the most fulfilling part of your work, Naz?
Seeing people come in and being diagnosed. Actually, I have a touchy subject right now just coming. My wife actually got diagnosed 2 months ago during the COVID. And she diagnosed with breast cancer. She had operation. Now she has to go to I believe, radiation.
Oh, I'm sorry.
She got to go next week. So now I've seen the people who, because I've been there 14 years. And so I've seen people who had cancer and cured, and now they're living a happy life. That's the most part of it. And they enjoy their grandkids, they enjoy their wedding for their daughters. That's like fulfilling, you know. That's amazing to see people's eyes and say, oh my God, this is like, you know, make you cry. I'm actually like tearing up right now. Just look, like I've seen people like, they say, I don't know, Naz, I don't know how, because I connect with people. I talk to everybody. They can pick up, everybody have my cell phone. All my customer employees, everybody have my cell phone number.
Yeah.
And they call me and it says,
You must get a lot of calls, but that's great. You know, if we can help, we're happy to do that with your wife's care.
Yes, thank you so much. So when I see the people say, I don't know, my nails, my hair, my this, I say, you're beautiful. Don't worry about it. You're gonna be fine. And now they come back and they say, oh my God, Naz, look at me. I got new hair. I got new nails. My nails are good. You know what I mean? They're happy, you know? So it's like, it makes the whole different, like what you create, you feel like it's not a work. It's not like you just come in and enjoying your life every single day.
That's great. And you have a big heart in that the world needs more people that really care about what, you know, what they put out, what they create, and, you know, something that's healthy and beneficial. Do you have a favorite product in your line?
I love lavender removers. I know everybody loves the unscented one. My favorite is the lavender one.
I love the lavender too. Yeah, that's a great
And also the deep nutrition, actually, there's another product. I don't know if you have those. Deep nutrition has been helping a lot of people, like people especially getting brittle nails or coming through all these chemicals, you know, and it's been helping. So I've been getting a lot of reviews about it that it's helping. I don't know what's helping them more than anything else. So it's one of my other second favorite part of deep nutrition. Actually give it out. It's always in my car. People say, oh, I see somebody's nails. My wife said, who, you don't know this person? I said, no, I just looked at her nails. I think she needs something like that. I said, just try this for 3 weeks, you know. They laugh at me like, you know, I'm going in a nice restaurant and sitting in a jacket and just handing over a nail polish out of my pocket and say, what else you got in your pocket?
And last question.
Sure.
What do you see next for Karma Organics? Like, are you going to open another store perhaps in California?
I know everybody keep asking. Before, my plan was to open a few more, but after COVID happened, let's see what happened end of this year, you know?
Yeah.
What's people are still scared right now. So it's like, I understand people are very, very scared. And thanks God the vaccine is coming around, and see what happened next, you know?
Yeah. Well, thank you so much for
Right,
coming
thank
on
you.
and being interviewed here. We really appreciate your time.
Oh, anytime.
Yeah.
Okay, thank you, Naz. And we'll look forward to all your new products, and we'll stay in touch.
Thank you.
Becky, so you're on.
Yay. Okay, so I'm going to do this probably a little different than you would like, because we tried doing the filming and it did not work. So we're still working on that, and it'll be posted on my website, which is oncologyspasolutions.com. You can go to the video tab and we should have it next week. But instead, I'm going to walk you through it because it was too difficult to figure out how to do this. Like, how can I show you what I'm doing live like this without having cameras, and I'm not that techie. So let's talk about do-it-yourself at-home manicure and what makes this manicure different than a regular manicure. So there are a few things that you need to consider when you are going through treatment. As Dr. Singhal was mentioning, all the different things that can happen, and the skin is different. So I'm going to reiterate a couple of things that she had on her list as well, but that are really important. So as you're going through chemotherapy, you should not soak your nails, or hands or feet, in water. So a traditional manicure would kind of be out, okay? But a lot of places now do what is called a dry manicure. So if you want to go someplace, follow the rules that Dr. Singhal said earlier about bringing your own tools and making sure they don't do certain things, and make sure that it's a dry manicure. When you're at home wearing gloves, when washing dishes or working in the garden, Or as Dr. Sengal says, I used to tell my patients, go home and tell your husband that Becky said you don't have to do the dishes for a while and that they have to do the dishes. If you can get away with that, it's best not to be in water, okay? We want to avoid anything that would break or cut the skin barrier. So that means no cuticle cutting, okay? So no use of those kinds of tools or using any sharp files or tools that could potentially break or cut the skin barrier. Because remember, when you're on chemotherapy, your immune system is down. So it's not functioning like it should. And you're going to be at a higher risk for infection. So we want to avoid anything that's going to open the barrier to the skin. So first thing, I have a little picture there so you can see. In your box, you guys got this fabulous nail polish remover. You got a cuticle oil. You got a nail strengthener, a nail polish, and a 7-in-1 elixir. And I'm going to walk through the steps of how you are going to use those products and then anything else that you want to put into that. So first thing, always super important, wash your hands. So go to the sink, wash your hands, soap and water, and dry them thoroughly. Follow up with a moisturizer of some sort. So have a good hydrating cream that's got nice, safe ingredients in it. And apply that to your hands, your nails. Give yourself a little bit of love. Do even your arms, okay? And even better, if you've got a partner in the home, have them do this for you because it feels even better then, okay? And then maybe you'll be training them a new technique that they could use on you later, but also maybe you never know. I've had some people say that they enjoyed doing the partner massage or partner treatment so much they actually went to school afterwards, so you never know. But just give yourself some love, okay? So right now we want to hydrate. Remember the doctor said how dry that skin is and it doesn't have the ability to keep that moisture in. There's something called TEWL, which stands for Trans-Epidermal Water Loss. So trans-epidermal water loss. And that's what happens when your barrier is compromised. So as much moisturizer as you can throughout the day as often as possible, okay? And then gather all your supplies so that you have everything that I just lifted up, plus in the other picture. I like cotton balls for some things. I like cotton pads for other things. I like using these little buffer blocks, okay? Because they're soft and small and I can control them and make sure that I don't cut myself. Having some sort of nail file that's not sharp on the edges. An orange stick that we are going to wrap with cotton, and that is to protect your cuticle during this time. And I'll talk about how we're going to use that in a little bit. I also have another little orange stick that we can use to clean underneath the fingernails if you need to, but always make sure you don't do anything that's going to harm yourself. So go very gentle, okay? So once you've got all your supplies gathered, here are the steps. So we're going to take and remove any nail polish that you have on. So I like the cotton pad for that. So I'm going to use the cotton pad and my nail polish remover, and I'm going to take off all that old polish, okay? And what I noticed with this particular product, because I just started working with this product, is you got to massage it just a little bit, but it's very gentle and it doesn't have a strong scent. And as Brooke mentioned, when you're done, you don't feel all dried out like you do with an acetone nail polish remover. So it's really nice, okay? So take off all that old nail polish. And then we're going to apply the cuticle oil, and it's super easy. Just apply it right to the nail and the cuticle. And then I like to take that and do a massage. So you're actually massaging the nail itself and the cuticle, okay? So we really want to get it in there. Then we're going to take that orange stick, take a cotton ball, and just pull off a little bit of that cotton. I've already done this side, but I'm just going to show you how easy it is to do it on this side, if you can see. So just take the cotton and just twist and wrap it around like that. And now you've got a little buffer on the end of that orange stick so that you won't harm yourself, okay? With that orange stick, now you're going to take and just gently press back the cuticle, because cuticle has a tendency to stick to the nails. So we want to push it back gently so that as the nail grows, even though it's going to grow slower, we don't want any rips or tears in the cuticle, because that's what can happen. The perineum is very sensitive and can definitely tear, and then you'll be open for infection, and we don't want to go there. So gently push that back using the orange stick, okay? Then take your buffered block or your file, whichever you need, shape, smooth, and file your nails. So just go ahead and take care of them. So if you have any tears or cracks, so let's go ahead and just make them nice and smooth, right? So it's really about just comfort right now and just making sure they don't catch on anything. Then we're going to remove all the oil again with a nail polish and a cotton pad. We're gonna nail polish remover and a cotton pad. I wanna get all that residue of the oil and the moisture that I put on off my nail so that when I go to polish my nails, it will adhere and stay, okay? Because that's important too. So I'm gonna take that and get all of that off. Then I'm gonna go and wash my hands again with warm soap and water, drying them with a towel. Once they're dry, now my nails are prepped and ready for polish, okay? And so with the kit that you have, I'm gonna suggest that you take the 7-in-1 elixir and use that as a base coat, or you can use a base coat if you have one, okay? We'll start with that. Then we're gonna put 2 coats of your polish on, whatever color you decide, put 2 coats of the polish on. Then you're gonna follow up with either a top coat or you're going to use the nail strengthener that you got in your kit as a top coat. And then you are ready to go. So it's pretty simple, pretty easy. And the wearability, I have noticed, like I said, I just started using this line, but I polished my nails when I got this kit, so almost 2 weeks ago, and they're still on and they still look pretty good. Okay, so that's wonderful. You want to let them go as long as you can. Although, because you're using products with good ingredients, you don't have to worry about if you decide to change your mind, right? And you want to change the color and you want to do something different, you're not going to be harming yourself by changing them often. You know, back when we didn't have that as an option and we only had acetone type nail polish removers, we suggested that you wait at least 2 weeks, if not longer, because we didn't want to have that harm or those chemicals. You don't have to worry about that now. This is a great, super easy product. Remember, I'm going to have a demo video up on the website, which is oncologyspasolutions.com. And again, once you get to that homepage, just click on the video and it'll take you to a page where you'll get to see the video. Okay.
Oh, well, thank you, thank you, Becky. I wanted to add one other small tip, and I saw this tip on one of the YouTubes that my daughter was watching, and what she does is they set their phone on a stand so that the camera's facing up, and then you do your manicure under the phone so that you can watch as you're doing it. And for those of us that need a little assistance, it helps quite a lot because it provides you with this kind of ongoing magnification that you can see as you're doing it.
I forgot you mentioned that, and I thought that is such a great idea. Do you know where they can get those phone stands for that?
Oh, it's just
like
the regular ones. Like if you're doing a YouTube or something like that, you can just turn it so that the phone sits so that you can see it.
Flip it and magnify it, and that way you don't have to wear the glasses and you can actually see your nails when you're painting them.
Right, exactly.
Yes.
It's kind of, I'm a surgeon, so I never have my nails done, but I did see it and I thought, oh, hey, that's a cool idea.
It's a great idea. Thank you for sharing.
Yes, excellent. So Julie.
Hello. Okay, so I'm in a nice ambiance dark setting, which is perfect for a little breathing. One thing that I did just want to point out, having been a manicurist for 20 years, is that if you have lymphedema, your doctor should have given you, or your physical therapist should have given you, some tips to making sure that you keep your skin hydrated and that no one ever cuts your cuticle, because if you get any sort of inflammation in there or create a histamine response, that can trigger lymphedema. So it's not just about when you're in chemotherapy, but also if you're at risk of lymphedema, be careful. But if you definitely have a lymphedema diagnosis, I would just caution on letting anyone cut your cuticles. So, and then also please remember your sunblock on the back of your hands, especially, and protecting that arm and both arms against skin cancer. And again, heat can trigger lymphedema. So if we're just looking at the hand, I just want to extend the hand up through the arm for you. So for breath, one of the things I just wanted to talk about is that I know it can be very disheartening because we don't realize how much we use our hands and how much we rely on our feet until they're taken away, or until certain functionality, I should say, is taken away. And so you can't get upset, just it's more about cultivating some compassion, some self-compassion, knowing that this is just temporary. Most of the nail conditions will go back to normal after treatment. So be kind to yourself. And when we talk about being kind, it's also what we're thinking about in our mind and how we treat ourselves. So this is a great time just for compassion. And so if you feel at all that anger starting to come up, or that frustration starting to come up, then the best thing we can do is to go to our breath. And so if you just do diaphragmatic or belly breathing, it's the easiest. You can do it anywhere, and no one even knows that you're doing it. You're not making any big loud noises or counting or anything. So let's just bring our awareness for a moment to our belly and just notice how you are breathing. So not trying to control it, but just notice how you're breathing. What we want to try and move to is on the inhale, the belly rises. So the belly starts to come out, maybe to touch your hands if your hands are on your belly. And on your exhale, your belly is going to come back down. So let's inhale for a count of 4. You can close your eyes if you want, and exhale for a count of 4. If you tend to breathe up in your clavicle area or your chest, really try to come down to your belly. So you may have to touch your belly in order to bring you down here. Okay, so again, continuing to breathe for a count of 4. And exhale for a count of 4. On your next breath, I want you to give a smile, even a half a smile, as you breathe. And if your natural breath is 4, great. If it's 5 or 6, that's fine too. Continuing to breathe, continuing to do at least a half a smile, if not a full smile. And if your eyes are closed, gently open your eyes. The breath is what always tells us what's going on in our mind and what's going on in our body. But the breath can be used to calm our body down. The reason we do a half a smile is it helps to relax what's called the parasympathetic nervous system, or some of you may have heard of the vagus nerve. It helps to automatically relax the body just by smiling. So these are things that you can do to breathe. Then you could try a smile. Next time you could think of someone you love or gratitude, cultivating that, and then going ahead and feeling that in your body. So when we breathe, when you practice this at home and breathe throughout the day several times, just like that, just taking, that was less than a minute probably to breathe. Okay, maybe 2 minutes because I talked. But every time you come back here and you come back and you slow your breathing down to your belly, your body will begin to crave it and want it more. So this is great to do as you're getting upset by anything, your kids are yelling at you, you're going to the doctor, you're at a red light and you wanted it to be green and you're not very happy. Go to your breath. That is your friend, and it will really make a change in your life the more you practice it. That's it.
All right, you're muted, Dr. Singhal.
Well, thank you, Julie. I really appreciate the help that you're giving us to calm our minds down, because I think for all of us during the time of COVID, it's important. And if you have have cancer on top of that, I think a little extra help is required. So I think we're going to go to the panel. And so last time we had a lot of discussion on the panel. And so I'm happy to take questions from people. If people on the call have questions, we can certainly do that. And then the other thing that we have talked often about amongst ourselves is that when people come to the doctor, they don't tell the doctor all these things, but they tell the estheticians, they tell the salon people, all of these people, and they ask their questions. So I'm going to start with Becky. What do patients ask you about their nails?
Wow, so many questions. Like, first of all is, can I have a manicure? That's what they want. Or why can't I have a manicure because my doctor said no? Or why can't I have acrylic nails? So there's a lot of questions that come up in regards to that. And, we don't refer them back to their doctor for every little thing, but we need to know what they can and cannot do. But it's typically in and around, can I have a manicure? That's what I hear the most often. So again, I just inform them that yes, they can, but they need to do it in the proper way, right? Because for a lot of people, and I hear this actually from a lot of patients, they say that the one thing that carried them through their chemo was the ability to have pretty nails, hands and feet, right? Because that's something that they were used to doing and they didn't want to stop that. It was something that made them feel normal and made them feel like themselves. So again, as long as you follow the rules of not soaking, no cuticle cutting, using good products, you can have a manicure or pedicure anytime. CJ's on this call too. And I'm looking forward to CJ getting in and talking about pedicures, because that really is one that people ask a lot of questions about.
Yeah, so let's go to CJ. So CJ is a pedicure specialist. And so tell us, CJ, what tips did you offer patients?
So I'm in a different situation to where for 24 years I dealt with the end user because I had my own salon and I'm a licensed nail technician. So, but we didn't have education about this. I always say when I was growing up in the salon, we didn't have nearly the education that we have available now. However, I'm able to take my experience from that and my remembrances from the hundreds and hundreds of clients that I dealt with on a daily basis into my distributorship, where now I deal primarily, I don't deal with the end user, I deal with the technician who is dealing with the end user. So what I get are all the questions from the nail technicians, because we do have more education now, but we also have more people that are affected by various diseases such as cancer or diabetes, immune compromised, whatever it is. I mean, so much more now than what we had or what I had in my salon. And there's a variety of different questions. I get pictures constantly of the discoloration of the nails, of the cracking of the nails, the peeling of the nails, the ridges that are on the nails, how to help the client with that, how to help the client manage that. And that's for the toes and the feet, because our nails that are compromised we're just not talking about on our hands. We're talking about on our feet as well. So we get a lot of questions about discoloration and, you know, what can we put on it to help with that. We get a lot of questions about treating the cuticles and cutting the nails and I mean, everything that you talked about today and everything that you don't have enough time to talk about. So a couple of things that I've always said, I have either done this life before, or I just had this innate something in me, because there were so many things that I did in my salon, and I haven't had my salon since 2009. So it's been a long time. But between 1987 and 2009, there were things that I did, as Naz was talking about. We didn't have the big pedicure chairs. We had the stainless steel bowls. We never taught our technicians, and I did all our training. We never taught our technicians, and I don't like this word, and I know everybody uses it, and I know when it's used, it's not always meant to be used aggressively, but we talk about pushing back the cuticles. I don't like that word, because the end user and sometimes the technicians will take that too graphically, if you will. So I always say, be gentle and erase around that cuticle edge. That is a big thing that I talk with my technicians about. Since I've taken Becky's oncology course, I have been way more aware in regards to ingredients. And although I do have products here that we do not recommend for the oncology care client, we also were able to bring in products that we do recommend. So, I mean, I'm trying to answer the question. It's just such a broad answer. It's a really, really broad answer. But we're slowly but surely bringing on our technicians to get qualified in the area of learning about ingredients, learning about oncology care, learning about what we can and we can't do, because it's mind blowing. I know for me to find out the what can happen during different phases of oncology care and what us as technicians can do. And every bit of education that I'm able to learn and pass on to my clients, the one thing that I say all the time is I thank God every day that in my 24 years of servicing the clients that I did, that I didn't have anything come back on us, because there's a lot of damage that can be caused by uninformed technicians. Mm-hmm. So the knowledge that I learned through Becky, through the OSS, that we're able to bring to our technicians, I believe is really helping. And it's helping in a way to get to the end user, because that's who our technicians take care of. And truly, that is what it's all about, especially, I mean, I say especially now, always it's been about that. But through this pandemic, I think there's been more of an awareness of how careful we really need to be as technicians when it comes to care in our pedicure rooms and in our nail rooms, because it isn't about getting a manicure. It isn't about getting a pedicure. It's about offering a service to our clients that is safe, yet gives them the beautification and the pampering that they want and they deserve.
No, that's great, CJ. And you know, what's really nice about it is that, you know, you've had a whole lifetime of listening to these issues, right? And people all over the country are having these issues. This is not just a California thing. This is not, I mean, so you can see what a big problem this is, and how now we're coming towards a solution. We're coming towards some things that people can do to take care of these things. Brooke, what do the patients tell you that they don't tell their doctors?
I'm sorry, can I just say one last thing? I made a note because I didn't want to forget to say it. So I apologize for jumping in on you there,
Yeah,
Brooke.
go ahead.
One of the things that, again, innate, okay, because when I had my salon, I had a massage therapist that was diagnosed with cancer while she was working for us. And one of the things that I encourage everybody to do when they are told of anybody, whether it's a family member or their clients that has just been diagnosed with cancer, is start then. Start at that point with your self-care, with proper conditioning of the cuticles and the nails, whether it's on the hands or the feet, with proper products to start using on your skin, because all that pre-care, and I saw the difference it made in my massage therapist. I saw the difference it made. Not that it completely stopped what was just going to naturally happen in her body because of the chemotherapy, but I am 150% convinced that the products that I was able to introduce to her to care for her skin and her nails made a huge difference in how bad it actually got. So if any point that I want to get across here today to all of those that are listening that are struggling through something like this is the sooner the better.
Yes.
Okay, Brooke.
Second that.
Yeah, exactly.
Yeah, those are some awesome points, CJ. And I would say the number one thing that I get both for skin and nails is about hyperpigmentation or darkening in some areas of the skin and nails. Actually, Becky, I'm not sure if you still sell this, but the tamanu oil.
Yes. Yes.
Yeah. So I suggested that as a really, because tamanu oil, I love oils, first of all, and I really like utilizing them. They're gentle enough. Of course, it depends on, your skin type and everything like that. But tamanu oil is very healing, as well as calendula oil. And what I say is, definitely for the nails, like CJ said, the sooner the better, as far as the effects of like Taxol for hyperpigmentation. But as far as the skin goes, we want to be gentle with the skin. Well, and the nails too, right? But we want to be gentle. We want to address calming and hydrating the skin during treatment or pre-treatment, and then address the hyperpigmentation of the skin later. So I know I'm jumping to the skin, but in general, Dr. Singhal, it has to do with hyperpigmentation. What do I do about this? Because, part of feeling like yourself is kind of restoring your skin and your nails to what it was like before, and really being affected for the cosmetic side effects. So.
Yeah, and I'll tell you a quick story about one of my patients, and you don't really understand the impact of these diseases until you really sit down and listen to some of the people's experience. And one of the patients I had breast cancer a number of years ago, and she had surgery, and she wouldn't wear certain clothes, she wouldn't go out of the house, she wouldn't do this, that, and the other thing. She definitely rearranged her bathroom so that she couldn't watch herself get out of the shower. And she had the sensation that she had been maimed by this experience. And so every scar to her, everything was just yet another evidence of being maimed. And I was, to be fair, she had breast cancer 25 years ago. And so I thought, hey, you know what? We've done such a good job. Like, you're alive 25 years later. But to her, it was a defining moment. And it was a moment in which she really couldn't easily move past. And so you just don't understand on each and every person what the impact is going to be. And so every little thing that we can contribute, I think will be super helpful. So Julie, there's one question at the panel that says, what do I do to cover up the nails when they're black? What do you do?
You know what? Well, there's not much you can do. That's the reason that most people paint their nails or whatever, polish their nails. I mean, traditionally, when we developed our course 14 years ago, we suggested no, just natural nails, but no color, because you can tell a lot, and nurses can tell a lot about oxygenation of the body or anything like that through the nails. So I traditionally don't really encourage painting the nails at all. The only reason we moved to that is because of the black nails. There have been some studies in Scotland and other places about whether or not using black nail polish could prevent some of the nail challenges. I don't think that, and someone had asked about that, and I know a lot of blogs write about it. I'm not sure if that is a standard, because we would have seen that as a protocol in hospitals. But I was with a team in Scotland that was doing the research on that 4 years ago. So I think for some people it helps, and some people it doesn't help. And it's the same thing with the gloves. So for some people, the gloves help really well, and some people, they don't help very well on. So those are just, I deviated from your black nail polish, but color's why people paint their nails, to hide the black.
Just to cover.
Right. And Harriet mentioned something which I feel like we briefly glossed over. We talked a lot more about it on the skincare section of this about, so some of these drugs like Taxol, like cisplatin, they sit in your skin. And what they do in the skin is that they have photoreaction with the sun. So if you go out in the sun, and what you'll notice as cancer patients is that you are way more sun sensitive, and you will sunburn like you've never sunburned before if you don't pay much attention to it. And it's the drug somehow, Taxol is a double ring structure, and so it absorbs the sun, and the light hits it in a certain way, and you end up with hyperpigmentation. Cisplatin, the same thing. And so there's some of these drugs that really cause this photosensitivity. So when you think about your moisturizers on your hands, and when you think about your moisturizers on your skin, it definitely should include sunscreen, but not this, but a mineral-based sunscreen, not an oxybenzone.
Oxybenzone or
Right. And as I said, we talked a lot about this on the other skincare discussion, but it's true for the hands and true for the moisturizers as well.
Mm-hmm.
Okay, Naz.
I was going to inject something in regards to that, because this kind of goes along with it. And the reason why we don't suggest gel manicures, for a couple reasons. One, because it's super hard to get off, but you also have to put your hands under some sort of light that cures that polish. That will also be an interaction and a contraindication for photosensitive medications.
Right. And so, Naz, you had mentioned, talking to a lot of the women, and that what we have said is that a lot of these things are really super important when you're undergoing the treatment. But then after treatment, then what do you find that the patients are doing? Are they going back to their gels and acrylics? Do you find that they're staying with the simpler regimens?
Yeah, they actually, most of them coming back to do regular nails, because they've seen it once they get the gels and they take it off, and underneath the nails are very thin, and it takes a long time to recover. So they went back to, they said, we're never going back again to dip powder or gel or acrylic or nothing, so they're coming back to the natural. They just want to look natural, clean nails,
Yeah. So tell me about biotin. What do you think about biotin?
I think it's very good, but I haven't tried biotin. So I can't really tell, but I read a lot about it. Like biotin is supposed to be very good for your nails. So
yeah, because we talk about it. We talk about these things. And what do you think is your most popular color? What do you think is?
So many.
You think it's reds, reds and the pinks and the what?
So it's all family. So wine o'clock is one of the colors, like a semi-neutral color, very popular. May blossom is like a simple, nice and clean look. It's very, very popular. Then in the red families, you have red and even, Christmas in July, Those are very popular. And somebody wants like a dark color, then you have Curtain Call and Bowery After Dark. So names are fun to pick out too. We're actually creating a new line, so men's line, because I don't know if you noticed that a lot of men's are starting to wear. And in our salon, we have about 30% men's coming now.
Wow.
That's good because
That's great.
a lot of our prostate cancer patients have these problems because they're on anti-estrogens. The nails get thin. They get a lot of untoward side effects, and particularly around their nails as well. So
a couple main reasons. One of the women actually told me as a joke, she says, all my sheets have tear in the bottom. Can you help my husband cut his nails? Because that was the main reason. And I started promoting those, and a lot of men start to come in because they want to make sure their nails looks good too. And some of them are, have a hip surgery or knee surgery. They can't bend over and cut, and their nails are harder. So it's for their wives or girlfriend, it'd be hard for them to cut their nail. So they come in, they sit down in a nice place, and they actually get hooked on it. They say, oh my God, this is the best thing. That's why my wife never told me to get her nails done, because she knows I'm going to get addicted to this,
That's funny. So have you noticed anything in particular that patients are telling you when they're going through chemotherapy that might help any of our patients that are on the call, or anything that comes to mind?
That's one of the things they always complain about, is the lifting their nails. So for them, it's the best to keep it short and nice and clean. And like Becky said, don't use too much water. I mean, you have to wash hands a lot, but make sure you dry it out right away. Make sure you underneath the nails too, maybe clean it a little bit more better. Use a cotton, or make sure it's completely dry. Don't leave the moisture in there. Once there's the moisture in there, it goes underneath the nails. When it's lifted, then it stay there, So make sure it's nice and clean all the time.
Right. And what do you think about the fungus that gets in the nails? What do you think about that?
So that's what it is. They got it because once they lifted the nails, so make sure it has it all the time, clean it. So whenever we have a patient and they have, I say patient, but when we have a clients and they have the lifted and they have all, the white stuff goes underneath.
Yeah.
So we make sure we take time and scrape it all out completely, or cut it. It looks ugly a little bit. Sometimes they say, oh my God, I'm going to have a cut nails. But I say, it's better for you, because if you go to podiatrist, they're going to cut the whole thing off, and they're not gonna clear the whole part of it. At least we can clean it completely and keep putting. Also, I suggest people using a tea tree oil. Tea tree oil, did I pronounce it right?
Yeah.
Which helps a lot because it's antibacterial, so it kind of helps a lot. And
Great. So do we have any other questions from people that are on?
Yeah, Paloma says, my face got really swollen from the side effects of immunotherapy and the steroids I was taking. It's been 2 years and still gets swollen. Do you suggest anything for this?
So there's a couple of things. One is on the medical side. I feel like, Paloma, you might want to head back to your dermatologist to make sure that you're not allergic, right? So it's potentially that you're allergic to something, and that's causing some swelling. But they would have to allergy test you for the stuff that you're using on your face.
Mm-hmm.
And then once the doctor clears you from the allergy version of that, then we can work with you on the skin and the skin products. But again, it would go back to patch testing, right? And making sure that you're not actually having an allergic reaction. Okay, any other questions? Okay, so I have a question back to CJ. Okay, so you are our pedicure specialist. So tell me, what constitutes the perfect pedicure?
Oh goodness. Well, I think first of all, what constitutes the perfect technician is being able to master the art of empathy, especially when it comes to oncology care. I always say that a pedicure is a pedicure is a pedicure. If you look up pedicure in the dictionary, it says it's pedicure, it's foot care. It's primarily manicuring of the toenails. So regardless of what product you use, the majority of them have a soak. So you could soak or use it in a spray bottle. They have a callus care product. Some may have an exfoliating care product, and then they have a massage. That really is considered a pedicure. So the perfect pedicure, in my opinion, is what our technicians do in between all those steps that make it their own. And the reason why that is so important is because if you're making it your own, you really feel it. You own it. You have the passion about it. I can go in there and soak, exfoliate, callus debris, massage, and polish, and you could be walking out like you're in heaven because I have the passion to do that, and I'm going to show that in my service. I can also be the person that does that, and the mask and the heated towels and all the other ambiance you want to add into it. But yet I'm cold, I'm quick in my actions, I'm going through the motions. It doesn't make it any better. So what's the perfect pedicure? Making sure that you are where you're supposed to be and you're loving what you do, because that is definitely going to come across to your client.
That is really good advice.
Yeah.
That is really good advice. So that's good. So Becky, anything else that we should be sure to remind people and talk about?
I think we pretty much covered everything.
Great.
The only other thing that I would say is take care of yourself. And we kind of mentioned this in the beginning, but that self-care is so important. And it's not a vanity issue. It's not a selfish issue. It's actually really, really important, because when we're going through a tough time in our life and we're going through a cancer journey, we need to love ourselves and be gentle with ourselves. And if it means, I'm going to go have a manicure today, or I'm going to go have a facial today, if that's what you want to do, I think you should do it. I don't know if you saw this quote at the bottom of this page that we're on right here, but never apologize for being sensitive or emotional. Let this be a sign that you've got a big heart and you aren't afraid to let others see it, because showing your emotions is a sign of strength. And you know what, when we're on that journey, sometimes we don't feel strong, but love yourself and just remind yourself that you are worthy, you are enough, and take good care of yourself.
No, those are, go ahead, CJ.
I just want to add one more thing. I do this all the time. I speak and then I think, oh yeah, I wanted to say that. But for all those that are listening that are going through whatever journey you're going through, the one thing I would definitely caution is to make sure the person that you're working with to maintain the beauty that you deserve is knowledgeable. And that is huge, because as Naz knows, there's tons and tons, and all of you know, actually, there's tons and tons of technicians out there, whether it be for skincare, nail care, feet care, whatever it may be. But not all of them really know how to manage this type of situation. And that is very important.
Good point.
Excellent.
Glad you added that.
Yeah, so I'd like to thank all the panelists and really appreciate your time. Sorry, Brooke, you have something?
You're muted.
I am not muted.
I am.
Yeah, okay.
Naz, do you have your hand up, or?
Yeah, just a quick thing.
Sure.
When you just say about the employees, so I still have the same employees since I opened in 2007, 14 employees, same.
Yeah.
That's excellent.
Nice.
Great.
And so you are located in New Jersey, and so I'm sure that we have some people on that will visit you at some point.
Yeah.
when visiting becomes a problem.
Ridgewood, New Jersey, and one in Englewood, New Jersey.
Yeah, nice.
I was gonna say, how can people find oncology trained nail technicians in their area?
Super good point. We do have the Spot On website, so it's spotoncares.org. And we are in the process of putting all the names in of people where they live. It's not on there yet, so just know that if you go there, you're going to go, what? Where is it? But you can send me an email, and my email's right there, becky@oncologyspasolutions.com. I do have a big database, about 7,000 people. We have maybe 100 in the nails, maybe not that many yet, but we're working on it as much as we can. COVID kind of slowed that down a little bit, but you can contact myself if you're in Florida, or even if you're not in Florida, you can contact CJ because she's got a list of people as well. And just reach out and we can connect you.
Wow.
Excellent. Well, I thank you all very much for joining us today. And this this will be posted on the Hope and Beauty YouTube channel. And so you can always reach out to any of us. The nail care boxes on the website, the emails for everybody are listed. And so if you have a question, just reach out and we're happy to answer it. Any last thoughts from anybody? And we'll see you next time.
Thank you.
That's it.
Okay. Goodbye.
Thank you so much.
Bye, Naz.
Bye.